We do have Dr. Kevin Kavanagh with us right now. Good morning, Doc.
Good morning, sir.
How are you this morning?
Doing pretty good.
Just had a story. Let me ask you about it here. Doctor in Israel might have the virus again 3 months after he first tested positive. And the newest thing to look for is for tiny red dots in your mouth. Have you heard that?
Well, I haven't heard it, but I'm not surprised. We do know the virus can cause a vasculitis long term, or if you're several weeks out. For example, with Kawasaki's disease, we've heard about COVID toes. So this is not, again, not the flu virus. The flu virus is a lung virus. This virus affects every organ in the body, making it somewhat scary, so we need to respect it.
You were going to, you followed up, I think, on another story we were talking about the other day. What is it? I can't remember what you said.
Well, that had to do with the reports of the South Korean school children. And I took a look at the data. And as you know, the younger children, 0 to 9, appeared to spread the virus less. And the question was, well, what happens with the 10 to 19 group, the older children? And it appeared that they spread it more. Well, it now appears, if you look at the data, that they actually spread it even greater than the 20 to 29 group. So that's of concern. So these children do spread the virus. And of course, as we've talked about, they may not get severely sick to the point where they would succumb or die of the virus, but we're learning that there can be lasting health problems with this virus affecting many different organ systems, so that there is concern. Granted, the majority will do just fine and not having symptoms, but there's concern about their parents, and there's concern about the children who would get severely sick.
Did you notice, you probably did, the president's press conference yesterday? It seemed like to me he had just about done a 180. Was encouraging people to wear masks, and what's gotten into him?
Well, I think the reality of what's going on in the southern United States, the hospitalizations are back up to where they were. We peaked over 1,000 deaths yesterday, and that's not good. And of course, that 1,000 deaths is with all our treatment advances. And if we run out of hospital beds, run out of remdesivir, you'd expect that death rate probably to double. So it is quite scary. And with the infections looking like they're not giving a really good, long-lasting antibody response in some of the milder affected people, this is of concern. So again, this virus, we need to stop it. We know how to stop it. And I'll be honest with you, Jack, about everybody is on board with wearing masks and social distancing and how to stop it. The only people we have to convince are the few callers that are calling into the program. So that is that I think is key. I mean, if Dr. Fauci and President Trump agree on something, maybe we should take notice and do that.
Absolutely. Now, you had some a medical procedure done yesterday. For those of you who don't know, our good doctor here is a retired physician, and you are probably a real crappy patient, because I always hear doctors are the worst.
Well, yes, I'm not the best. I must admit that. But and I usually don't talk about my health problems, but I think it's important because I don't want to have a lot of collateral damage over there. I mean, we've been fairly negative on this program. And I should add, as negative as we have been, we weren't quite as negative as what the governor's conference was yesterday. They talked about lasting effects, concerns, problems, etc. So this is an important virus. But that being said, it's not important enough to avoid necessary medical care. Because if anybody knows how to keep you from getting an infection, it's the doctors. So when I went into the surgery center, my wife waited in the car, and I'm telling you, as bad as my procedure was, it wasn't as bad as what my wife went through waiting for 3 hours in a car with a temperature of 100 degrees outside.
Yeah.
But she wasn't allowed in. There was no one in the waiting room. Everyone wore masks. We were tested before going into that building. 2 days before, I had to get a virus test for the coronavirus. It was negative. And this is something that's important. In other states, they don't have the test. And when they have them, it's taken them 2 weeks to get them back. So again, the importance of getting testing money and making sure you have proper supplies and not getting your healthcare system overrun. So here I'm going into a building that is sparsely populated, everybody's social distancing, everybody's wearing masks, and all the customers have been tested for the virus before letting you in. So it doesn't take much medical knowledge to figure out that that's probably the safest type of retail establishment you could be in.
Right.
So if you've got a medical condition, please get treated. Right.
Yeah.
That's what I'm doing. So I think that's the important message.
Agree. Thank you.